There's no easier way to put an IVF service into a bad reputation unless you really sit down and talk to the patients and let them understand exactly what it is that they're paying for before they start the treatment. IVF, more than any other medical service, requires informed consent. Unlike most other medical procedures, for example, if you have an appendix that's ruptured, it needs to come out. Would you give us permission to remove the appendix? Or if you have a fibroid that you go in, the doctor goes in and removes your fibroid. But with IVF, the service that you pay for usually does not give you what you want. The pregnancy rates are between 25 to 35%, which means that there's a higher chance of failure than a chance of success with every cycle. This needs to be communicated clearly with the couple before they start treatment. Now, pregnancy is the end point. There could be a lot of challenges as you go along. The first is when you do the initial assessment, what are your chances of being able to produce good quality eggs? We do the AMH or the serum FSH. This helps us to guide this. And some people, you may have your FSH is normal and you go for the treatment, you still don't respond properly. These are eventualities that you need to prepare for. Or we stimulate you to provide eggs, you do not respond and produce the eggs. You should be able to prepare for this. Or some patients will over-respond, in which case we may have to cancel the cycle. Or even if you do not over-respond, we may collect the eggs, in which case we don't even get any eggs from you. Or we get the eggs, we fertilize them, all of them fail to fertilize. Or we try and generate the fertilized embryos and culture them. Sometimes they don't culture. So these little milestones need to be discussed very, very carefully with the couple before they start. Because if you don't, they believe they've paid for a service and they expect to get pregnant. And there's no easier way to put an IVF service into a bad reputation unless you really sit down and talk to the patients and let them understand exactly what it is that they're paying for before they start the treatment. More than any other aspect of medicine, the role of the doctor in engaging the patient for a cycle is more of a counselor, because you need to take them through this journey very carefully in a way that encourages them. The objective is not to discourage them from taking the treatment, but it's just to understand what could happen and understand that we know how to manage the situation to ensure that they get the best outcome that they deserve.